Insulin is one of the most effective antidiabetic drugs, which is absolutely indicated for people with type 1 diabetes, gestational diabetes, type 2 diabetes, when a person has changed diet, exercise, and used medication but uncontrolled blood sugar. To use it effectively, and patients can inject insulin at home, that is very important to know what is insulin, what are the effects, and when to use it most appropriately. The first. Insulin and its role in blood glucose control of diabetics. What is insulin? Insulin is a hormone secreted by beta cells of the islet of the pancreas. It is the only hormone that lowers blood glucose levels in the bloodstream and promote the storage of glucose in fat, muscle, liver and other body tissues. In the treatment of diabetes mellitus, depending on the specific patient case, it may be prescribed by a doctor, just like other diabetes medications. The role of insulin in the body of diabetics. Insulin role is in controlling blood sugar levels. It is also involved in the storage of fat. A lack of them, or an inability to adequately respond to it, can lead to the development of the symptoms of diabetes. Insulin is a hormone that is responsible for allowing glucose in the blood to enter the cells, providing them with the energy to function. It helps control blood glucose levels by signaling the liver and muscle and fat cells to take in glucose from the blood. Role of insulin, which inhibits phosphorylase enzyme, making glycogen convert slowly into glucose. Insulin enhances to absorb glucose. Insulin enhances the activity of enzymes to synthesize glycogen. Insulin greatly affects blood sugar. Diabetes is caused by high blood sugar. Insulin is a hormone that inhibits the conversion of glycogen into glucose and releases it into the bloodstream. If lack of them, glycogen will not stop metabolizing and give an excess amount of glucose into the bloodstream, causing diabetes. Purpose of insulin regimen: adding them for the body due to it produces not enough of this hormone as requirement. Some people with diabetes are unable to take oral medications. Gestational diabetes, type 2 diabetes with acute illness, use it to control blood sugar. The second. When patients with diabetes are treated with insulin. Indications for insulin injection: mandatory for type 1 diabetes and gestational diabetes that need to inject insulin. Type 1 diabetes occurs when the pancreas produces very little or no insulin. Without the presence of them, many of the body's cells cannot take glucose from the blood. Therefore, the body uses other sources of energy. Therapy is vital for replacing the insulin your body doesn't produce. Sugar cannot be metabolized into cells to produce energy for the body. As a result, blood sugar levels rise. Patients with type 1 diabetes require compulsory treatment with insulin injections to control blood sugar. The disease can occur at any age but mainly in children and adolescents. With type 2 diabetes that need to inject insulin when type 2 diabetes mellitus, when blood sugar is not controlled, blood glucose greater than 14 mmol, L and HbA1c greater than 11%. When the body has an infection, surgical intervention, liver failure, kidney failure, an allergy to hypoglycemic drugs, ketoacidosis or increased osmotic. Some people with type 2 diabetes can manage the disease well by controlling their weight, diet and exercise, and taking oral hypoglycemic medications. When blood sugar is not controlled by oral medication, it is mandatory to switch to injection. Insulin is the most powerful hypoglycemic drug. Hypoglycemia is the most common side effect when it is injected directly into the body. Excess them will also inhibit glycogen metabolism, causing a sharp drop in blood glucose. Pay attention to inject insulin according to doctor's guides. You want to learn more about diabetes and information about this disease? Please visit our website, forourhealthy.com.